I'm going to do a presentation on asthma. So asthma is a chronic inflammatory condition characterized by narrowing of the respiratory pathways leading to difficulty in breathing. It is usually a reversible condition. It is usually associated with what we call an atopic triad, where you have asthma, atopic dermatitis, and also allergic rhinitis. Usually there is a genetic aspect of asthma where you have individuals who have this atopic triad tend to get more asthmatic exacerbations. They also have other difficulties like nasal polyps and also sensitivity to drugs like aspirin. So usually for the obstruction of the airway to happen, there are some triggers that are known, which include dust, pet dadders and hair. We have insects like cockroaches, cold, especially these very cold months. You tend to find that exacerbations of asthma are more because of the cold. Then exercise. We also have viral upper respiratory tract infections, drugs like aspirin. There are some drugs that are used in the control of blood pressure called beta blockers. They tend also to exacerbate asthmatic attacks. Then smoke inhalation. So what usually happens is that you have the small bronchus, and because of the trigger, you have what we call muscle spasm, which cause constriction of the muscles in these small airways, and then as a result of this, there is increased permeability of the cells, and there is increased mucus secretions, and all these lead to narrowing of the airways and then difficulty in breathing. So this is an immune response, and is triggered by various immune mechanisms. I've said there are genetic factors and also there are environmental factors. So how do patients with the asthmatic attack present? One of them is dyspnea, which is difficulty in breathing. We have wheezing, which is audible breathing. You feel like there is a whistling sound when the individual is breathing. There is cough, and also there is use of other muscles of respiration due to the difficulty in getting out air out of our respiratory system. So asthma can be classified in several ways. There is intermittent, where you have individuals tend to get occasional episodes of airway blockage, and the blockage can also be mild, it can be moderate, and it can be severe. So how is asthma managed? One of them, and the biggest one, is avoidance of triggers. Sometimes for some people, keeping away pets, because the animal dadders from these pets can act as triggers. Then control of insects like cockroaches in the house. Having the rooms well aerated and well dusted frequently. Well arrangements of the rooms, especially where these individuals who have tendencies to get the bronchospasms live and sleep. And then there are medications. The medications used for the treatment of asthma are in various groups. We have what we call bronchodilators. In various groups, we have the short-acting beta agonists like salbutamol. We have anticholinergics. Then we have also long-acting beta agonists. And then we have corticosteroids. The corticosteroids, we have the inhaled ones, which are the mainstay of the control of asthma. And also we have the oral steroids, which are used for short periods, especially when individuals get episodes of asthmatic attack. And then you can also have leukotriene antagonists. which can be used because an individual has gotten into an asthmatic attack. So those are the mainstays of asthma, especially this cold month. Those individuals who have tendencies to get the bronchospasms, to take care of the environmental factors, and if the attacks persist and the use of the medication they are used to does not help to control the attacks, then they should seek medical assistance immediately. Thank you very much.